Joint pain and arthritis can have a real impact on your day-to-day life, but luckily Jacksonville Orthopedic Institute has a wide range of treatments to help you find some relief. We actually have Dr. Kevin Kaplan. He's one of several orthopedic surgeons at JOI. He's also the Jacksonville Jaguars team physician. Welcome.
It's good to be here.
Yeah. You doing all right after that?
Yeah, Mondays are busy, injury clinic, and obviously dealing with the losses, it's always better when you win. So.
Oh, well, tell us a little bit about your specialty.
So I do orthopedic sports medicine. I I operate on shoulders and knees, obviously treat all body parts. And one of the things that I've really gotten into recently is trying to get the body to heal naturally with stem cells and your body's harnessing your body's ability to heal. We used to do things like cortisone shots and anti-inflammatories, and those are great. They have a place, but orthobiologics is kind of the new age of how we treat injuries and arthritis.
So I know we're here to talk about stem cells and dive into a little bit of the new treatments, but can you give us a little bit more in-depth definition of what is arthritis?
Yeah, so arthritis really is a condition of a loss of cartilage over time. We all, from the minute we take our first step as a child, we start to wear on our joints, and the joints are protected by cartilage. That cartilage layer is very much like a tread on a tire, and unfortunately we only get one tire in our life for each joint. And so we start to wear those cells down, and those cartilage cells start to break down. And as they break down, then you start to feel that joint pain. And that process of cartilage breakdown and then getting things like bone spurs and swelling in the joint, that's the process of arthritis or degeneration of a joint.
Yeah, it's kind of crappy that we don't have a spare, but
that's right.
That's why you guys are here, and you do have a new form of treatment. Can you dive in a little bit more about those things?
Yeah, so stem cells, you hear this, it's kind of the catchphrase these days, and it really is, it's great, but it's kind of the wild, wild west. We see a lot of people trying to do different things with what are called PRP, or platelet-rich plasma, and that involves just drawing your blood and getting the platelets, which allows your body to heal. So, unfortunately, let's say you get a cut on your arm and you bleed, your body has the ability to heal itself. The platelets come, they help the cells come in and basically heal that wound. So we're harnessing that power, we're drawing the blood, we're spinning it down to get a concentrated level of those platelets and inject it into an area where you have a little bit of swelling or a little bit of cartilage wear or a tendon injury or a ligament injury. If you go a little further than that, and you can actually take stem cells out of your pelvis, you can get in other parts of your body as well, you can take those stem cells that actually have the ability to regrow or regenerate. There's something called, I'll throw a big word out there, mesenchymal cell, and that's a cell
that's a big word.
That's a big word. Test later. Mesenchymal cell is just a cell that's undifferentiated. It hasn't gone on to become a ligament or a tendon yet. And so those undifferentiated cells, if you concentrate those and put them again into, let's say you have a tendinitis, which is just an inflammation of a tendon, like tennis elbow.
Yeah.
A lot of people get that. Or if you have a ligament injury or arthritic conditions, if you inject those cells, then your body does have the ability to heal somewhat. And so that's what we're trying to do. It's at its infancy. It's something new, but I'm very excited about it, and the results are amazing.
It almost sounds like science fiction, right? So like me being a little bit of a Marvel nerd, I think of like Wolverine and his ability to heal so quickly. So now we're getting to that point, right?
We're
almost.
It's kind of Star Trek-y a little bit. When they see the machine, it looks a little bit weird, but we are. It used to be all screws and nails, and that's what orthopedics was. It's kind of the human carpentry specialty.
Yeah.
But now we're trying to do things in a much more sophisticated manner with ways that get the body to actually heal itself. So it's interesting.
So how does the stem cell and the PRP treatments actually help arthritis directly?
So by decreasing inflammation, decreasing swelling, there are cells that surround the joint called the synovium, and those put in healthy joint fluid. So we're trying to get those cells to put in healthy joint fluid, and there are certain areas of cartilage that can heal. Now, obviously, we've all seen on planes, remember those magazines where you saw a joint and they said, come to our clinic and we can make your joint space from here to here. That's kind of fake news. We're not trying to regrow a complete joint. But in cells that really haven't gone on to die, or what's called apoptosis, we can get those cells to heal and regenerate.
That's great.
Yeah.
So is there anything else that like our people out here might need to know about the treatment process very quickly?
Yeah, it takes about an hour to do the procedure if you do a true stem cell injection, aspiration injection. It's an outpatient in the office. You don't have to be put to sleep for it. It's relatively painless. It's just, like we just had a dentist on here. It's like going to the dentist and getting a Novocaine shot that makes numb while we harvest the stem cells. And then we use an ultrasound to put it exactly where we want to put it into the body. And patients patients are doing wonderful. You go on and see online patients that have had the procedure and they're extremely happy with it, and they're avoiding surgery. And I'm a surgeon.
Yeah.
I love doing surgery, but if we can keep some out of the operating room, it's much better.
Definitely. Well, thank you so much for being here, Doctor. And a special thanks to Jacksonville Orthopedic Institute for sponsoring this segment. For more information, you can log on to their website, which is joi.net, or visit kaplanstemcells.com, or simply just give them a call. Their number is JOI 2000. That's 564-2000.